special edition of Neighborhood News. Here with today, we are via WebEx, and we have a very special guest with us today. One of the front lines of the coronavirus pandemic. We're in the middle of this pandemic. We want to be able to give everyone all the information that is necessary. And we have the medical director of emergency services at Abrazo Health Hospitals, Dr. Hess. Thank you so much for taking the time to be with us today. I also want to thank you for being such an amazing healthcare hero for us here in our city.
Well, thank you so much, Vice Mayor, for having me here. It's great to be able to have time to communicate to the community this important message.
Yeah, and once again, I don't know how to thank you enough for putting your own life on the line, like your whole team. I know that coming into this year, no one thought that we'd be going through this right now. So thank you so much for the rapid response. I'm sure that you guys have gone through such a learning curve in the last couple of months, and we do not know how to thank you and your families and everyone that's part of your team. But we wanted to do this segment to give some education to our district. As you might know, Maryville and District 5 has been very impacted through this virus. So we want to give as much information about this virus as possible to our constituents and to everyone in the city of Phoenix. So once again, thank you so much for joining us. So can you please tell us about the role and responsibilities in your position?
Again, thank you so much. It's an honor to be here. We're all a community together, so it's important that we support one another through this. So thank you. In terms of my role, I'm lucky enough to get to work with amazing clinicians, nurses, and leaders in the hospital to really elevate our care every day. Really, our focus is always trying to make things better. The emergency department is often the front door of the hospital. And so we really need to make sure we're getting the care plan right from the get-go, and making sure that we're supporting our patients, whether they need to go home and continue their care there or stay with us for necessary treatments. So it's important even now in this kind of trying time to create an atmosphere of care for our patients at all Abrazo facilities.
So how are you and the other frontline workers at Abrazo doing? How are you guys handling this?
Yeah, it's a difficult time for everyone across the world, really, but especially I'd say frontline healthcare workers. We've had to change our processes of care, as you might imagine, how we manage patients and such with COVID out there, as well as wearing protective personal equipment. That's changed how we interact with patients and each other. It's made it a little bit more difficult, as you might imagine, in some cases very difficult because we have to wear masks covering our faces and these visors and such. And so there's a lack of comfort, but also it limits our ability sometimes to interact with our patients in the way we're used to. Patients can't see us smile and such. So we have to figure out other ways to interact and create relationships with our patients. So it's been challenging, but at the same time, I'm humbled every day by the amazing things I see and the hard work going on.
Is there anything that the community can do to support you guys at this tragic times, in these tragic times?
Yeah, I think in general with health, we recommend trying to stay healthy. And particularly now, the landscape has changed. Staying healthy means wearing masks. It means washing your hands very frequently. It means staying socially distant from one another. And that's very difficult. And of course, the routine health maintenance issues like trying to eat more fruits and vegetables and quitting smoking, all those things are great things to do as well.
Right. And in your opinion, in your professional opinion, what is the difference between coronavirus or COVID-19, how some people call it? What's the difference between that and the flu?
Yeah, there are similarities, that's for sure, but there are also important differences. And it appears that coronavirus is more dangerous than the flu for several reasons. A lot of the symptoms are similar, But with COVID in particular, there's a loss of taste and smell that's very much specific to COVID-19, it seems. And also, you seem to be asymptomatic for longer, so you'll be exposed to a person with COVID-19 and then won't have symptoms for a little longer than if you had the flu, but are still contagious. And also, you're contagious with COVID-19 for longer than the flu. So it makes it a far more dangerous situation because you're more able to spread it to those you care about and anyone else in your neighborhood, the community at large. So those are some key differences. In addition, you can develop some side effects or complications with COVID-19 that don't seem to be present with the flu, like blood clots in your lungs and legs as well. So there's some key differences.
And we hear a lot of people talk about, I mean, at least for the last couple of months, social distancing, 6 feet apart, wear a mask. How do you feel about these measures that we're being asked to take? And how does that stop the spread? If you agree with it.
I very much do agree with it. I very much support that. It seems that countries that are really doing extremely well with this and have very low rates of infection and death seem to be wearing masks with great frequency. So I'm excited to see masks gaining acceptance and more widespread use in the community. That's really great to see because we want to stamp this disease out together. That's awesome to see people moving in that direction. So it's unfortunate that even talking, often people think, oh, if you cough or sneeze, that's going to spread the virus. But even talking at a close distance one another, that can spread the disease very quickly. So wearing a mask can be very effective as well as staying distant. It's nice, humans want to be close to one another, but right now, if you're not living with that individual, you really need to maintain a distance if at all possible. So try talking from a greater distance and it'll decrease the spread. So that, of course, washing your hands, having hand sanitizer with you when you travel and you're not able to stay at home and you need to be out and about, having that sanitizer with you at all times is really helpful as well.
Are there, I know you touched this on this a little bit about how do we spread it. Are there other ways that the virus can be spread besides being close to someone, and what you just said? Is there other things that people need to take precautions on?
Yeah, I would say, if you can lessen the amount or frequency you're around someone that's not in your household, that's really ideal. Of course, if you have symptoms, isolating yourself because unfortunately it can be spread in a lot of bodily fluids and just by touching different surfaces and such. So the best way is to just not put yourself in the circumstance because we don't always realize, oh, I touched that handle and then I'm touching my face or those sorts of things. It's really difficult to control all of our human behaviors. So the best thing is to try not to put ourselves in the situation.
And you talked about a lot of the symptoms. Are there other symptoms that you can identify that you haven't talked about yet with corona?
Definitely. So in addition to cough, fever, body aches, headaches, um, and lack of taste and smell, sometimes patients can get diarrhea as well, and a sense of nausea. Fatigue can be very prevalent as well. So all those things are things to look out for.
I heard some people talk about that you can also get like a lot of swelling in your body. Is that true?
Sometimes you get a sense that there's swelling, and sometimes when I assess a patient with COVID-19, they'll say that, but then I can't really see that when I'm examining them, but they feel that way. So I certainly think that's something to look out for as well.
So what is your recommendation to a resident or to a constituent, someone in the city of Phoenix, that they think that they might have the virus? What do you recommend for them to do first?
Uh, I think it's important to stay isolated if you do think you're sick. Unfortunately, from the start of symptoms, the CDC is saying you can still spread the virus for 10 days. So the first thing is think about who's in your space, and if you are able to stay distant from those you love in your home, that's important too. Try to keep a little bit more distance, and some of the people that have gotten sick have have stayed in like one room of the house if possible, and that be their room. And if they come out, wear a mask. I think that that is an effective strategy. It's easy to say, well, I live with other people. What am I going to do? My family, it's just, it is what it is. But if you can take those precautions, I highly recommend that. And then monitor your symptoms really closely. Oftentimes, patients will tend to kind of put off going to seek help until sometimes it's too late, and we could intervene and make their lives better if they would have come seek help earlier. So that's another thing. So if you're really feeling shortness of breath, or really bad symptoms otherwise, really bad diarrhea, or whatever you're concerned about, feel free to seek help and seek care definitively in our emergency departments at Abrazo. We're here for you. But at the same time, I think too, if you're able to control those chronic conditions, we talked about wellness as well. So even before you get symptoms, making sure you're taking your medications. If you have diabetes, watching your diet and such that your doctor's already recommended. I think calling your doctor at the start of symptoms is good to set up a telemedicine visit. A lot of doctors are able to do that, so you get good advice from a doctor who knows you and your history. I think that's an effective route as well. So those would be a few answers to that question.
Well, thank you so much. Thank you so much for being with us today. We really appreciate your input. And once again, thank you for being a hero for our city and exposing yourself and your family and everyone else around you. We thank you for all the work that you guys do at Abrazo. I don't know how we will ever be able to thank you guys for all the work that you guys do for our community. And for everyone that is watching, please look at all the different locations where you guys can get tested. If you feel sick, go out there, get tested, do a test. We have a lot of sites out there where you guys can be doing these tests. And let's stay safe. Let's stay 6 feet apart, wash our hands, and try to stay as isolated as possible. Thank you so much.